Good evening, everyone. If you want to move up, you can. There is open space. Nobody's going to bite up in the front row. If you're more comfortable hanging out in the back, certainly hang out in the back. That's why it's there. I know some individuals are sitting down all day in their office, so standing might be a little bit easier. But good evening and welcome to Dable Square. This is the home of CCA Health Rhode Island's Providence headquarters, and thank you for joining us tonight. My name is Corey McCarty, and I'm proud to serve as the Senior Vice President and General Manager for CCA Health Rhode Island. A little facts about the building that you're in as you walk into this beautiful space. So this building that we're in is steeped in a lot of history in Providence. It was actually built in the late 1800s and was headquarters for Dable Rubber Manufacturing. And then for some of you who will remember, in the early 80s, it was actually converted into an indoor mall, kind of like a Faneuil Hall. So for me personally, I actually have a number of childhood memories of shopping in this mall as a kid, and so love seeing this space. What you can see and what you're seeing here tonight, though, I want to thank Wexford Science and Technology for making this incredible space what it is. They've really put a tremendous amount of investments, not only to this building, but to what you see in the Innovation District in downtown Providence. We're proud to call this building our home and really have this be the core of many of the topics that we're going to talk about here tonight and continue to have discussions about as we go forward. We have a great panel discussion here coming up, but first I just want to give you a little bit about CCA Health Rhode Island. So for those of you I have not had the opportunity to sit down with or speak with, CCA Health Rhode Island is really a mission-driven healthcare system. And so why that's a little bit different, we offer both health plans as well as services that are tailored specifically for older adults and individuals with significant needs. And so we actually do a little bit of both, the clinical side as well as the health plan side, which for the people that we serve is incredibly important for us to make sure that they have the right services to be safe in their home or be safe in the community. When you think about our mission is really that. We serve older adults, so Medicare eligible individuals, or individuals who are eligible for both Medicare and Medicaid. And our goal is really about making sure that those individuals are getting access to the care and the services that they need to keep them safe in the community or in the setting that's most appropriate for them. We officially entered the state in 2021, and while we are somewhat new into the state, I'm actually somewhat of a lifer, so I was born and raised in Rhode Island. I have been in this industry for 24 years, almost 25 years, working in the space in the healthcare delivery, trying to find solutions to really help change the way that care is delivered to our older adults and individuals with significant needs. What I really want to focus on tonight, though, is the panel discussion, because this is such a critical topic. We spend a lot of time on different topics in the healthcare delivery system in Rhode Island, but we don't typically spend a ton of time on behavioral health. And it's such a critical part of the delivery system and making sure that we're providing the right access to our individuals. So more specifically, we're talking about accessibility, and in this case, I would say it's at times lack of accessibility to the services that our people need. And this is an issue that we're really focused on. That's all right, you can pick it up. So it's a fact that mental health is an important driver of an individual's overall health. We all know that. It's also a fact, one that I think everyone in this room understands and appreciates, that far too many Rhode Islanders are struggling with access to the care they need. It could be that they're struggling to afford mental health services. It could be that they're stuck on a wait list because there's not enough providers to provide the services. It could be that they can't find a provider that speaks their language, and there's a barrier for them getting access to culturally competent care. And in many cases, it just could be that they're avoiding seeking to get help because of the stigma, unfortunately, that's attached to accessing those services. And so to address these gaps, it's critically important that all of you in the room, the broader healthcare leaders in Rhode Island, start to have these conversations, start to look at how we're delivering services, or in some cases not delivering services, to find new innovative ways to engage those individuals that are hard to find and hard to engage, to meet them where they are, to help them understand that utilizing these services is easy, and it breaks down the stigma. And to work to identify areas where we can really make a difference in the Rhode Island delivery system. That's what we're focused at CCA Health Rhode Island. It's why we're so proud to have the opportunity to be able to host tonight's event. And so again, I want to thank you all for being here, and thank you for your attention and passion to this issue. Feel free to stick around to the panel discussion and help yourself to drinks and snacks. Now, I'm excited to hand over to Dan McGowan, the Boston Globe, who will kick off this discussion. Thank you, Dan.
Thank you, everyone. You guys could come up. We're going to get our panel set up here in just a second. I want to thank you guys all so much for coming out tonight. As Corey said, this is an incredibly important topic. It's very broad. I want to get into some questions from the audience later on before we're finished with this. One thing I want to do just right off the top is thank CCA Health Rhode Island, Johnson & Wales, and the Rhode Island Foundation for sponsoring this event tonight. You guys make this possible, so thank you very much. I want to give a special shout out to my friend Neil Steinberg, who's in the room, the former president and CEO of the Rhode Island Foundation. And fun fact about him, this is the first time he has ever not worn a suit anywhere in Rhode Island. And so thanks for being here, Neil. We have an all-star panel for this, as I said, wide-ranging, very broad discussion. We're going to try to break it out a little bit into, I think some of the workforce challenges that we see, obviously some of the conversation around stigma, and then we're going to pin it all on Senator DeMario to solve our problem from the legislative standpoint. So let me introduce you to our panel first, and then we'll get right into it. We'll start with Dr. Nadine Haywamuda-Ligay, excuse me. She is the Vice President and Chief Medical Officer of the Providence Community Health Centers, and relatively new to this position, correct? So thank you so much for being here. Professor Samantha Rosenthal from Johnson & Wales. Samantha's the director, Professor Rosenthal is the director of the Center for Student Research and Interdisciplinary Collaboration. So thank you for being here. And of course, as I mentioned, Senator Ilana DeMario, who's not just a senator, because remember, that's a part-time job in our state, is also a licensed mental health counselor. And in the Senate, she represents District 36, North Kingstown, Narragansett, and of course, New Shoreham. So thank you for being here. I want to sort of level set this conversation. I'm going to start with you, Doctor. One of the challenges in kind of grabbing questions from people and just researching this is that kind of workforce challenge that we're really facing. It's in every profession, but I think it's especially so here when it comes to mental health care. And I'm wondering if you could kind of describe for our audience the challenges that you see every day and sort of what it means for the broader, kind of bigger picture.
Sure. So, Providence Community Health Center serves over 85,000 residents of South Providence, so it's a large majority of patients. And, we're definitely not immune to the challenges that we've had with staffing. And so to meet that need, we've been trying to recruit all sorts of different methods, whether that's getting more student involvement, whether that's developing training programs, having pathways for licensure for our mental health clinicians. So that's one of the ways that we've tried to target it, and knowing that our patients at PCHC otherwise have very, very difficult time accessing mental health resources, it's really important for us to make sure that we sustain that pipeline. So that's been a big goal of ours.
And just one quick follow-up for you. Are we losing kind of providers to neighboring states? Like, is there a barrier that we're seeing in Rhode Island that is maybe, competing with Massachusetts, something like that? What do you see sort of on the ground?
Yeah, it's a lot of those different types of things. We are a very small state, so that does have its own little challenges, but we're finding that sometimes reimbursement rates as well as pay in general can be higher in neighboring states, and sometimes that will detract people. So we're definitely trying as best as we can to stay competitive in the market so we can continue these services for our patients.
You mentioned those reimbursement rates. We're going to go down to Senator DeMario in a minute to fix all these problems. But Professor, one of the areas when we kind of prepped for this call, we talked, and Corey mentioned it in the beginning, is that sort of that stigma challenge. And I'm wondering if you could sort of now move to the conversation around the challenge just around simply asking for help, particularly among youth, but I think broadly.
Yeah, so thanks for that question. I think it's really important. What we do know is that more than half of adults who have mental illness are not getting adequate care or are not seeking the care that they need. And a big part of that, not all of it, has to do with stigma. And while over the past 2 decades or so, there has been tremendous progress. I think you would agree with me that you've seen it, right? People are more likely to talk about mental illness, are more open to that conversation, and yet the problem of stigma still persists. And I think that it's hard, right? It's hard to address. A lot of it could be personal, cultural, have to do with your family, your upbringing. But what we need to do is we need to implement anti-stigma campaigns, and we need to do it in our communities. We need to do it in our K through 12 system. We need to do it in higher education. We need to do it in places of worship. We need to do it in community centers. We need to meet people where they are. And we should have people leading that cause who look like, come from places like the people who most need to hear that message. And that's really going to be important. We need to be able to invest in that kind of, in those kinds of outreach intervention plans.
I'll add too, because I'll say it so you don't have to, the media needs to take a real look in the mirror, and that's starting with us at the Globe, but everywhere, because it's another place where I think that's really important to get behind. Senator, I'm, like I said, going to pin everything on you. You have a huge Herculean task at the State House. You have lots of competing priorities, but you are a specialist in this world, and so I'm curious, big picture, and we'll get nitty gritty in a second. What have you accomplished in the last couple of years that we should be actually excited about that maybe people even here in the room don't know about yet?
Sure. Am I on? Oh, I am. Hi. So I thank you for this opportunity to speak here tonight, and also for that question, because I think that while the task of fixing the access issue is a huge one, the answer does lie in a lot of pretty small little steps that, people might not really necessarily kind of be able to see from the outside, how those things connect. And, so one thing that I do want to highlight is that the General Assembly did this last session move forward with undertaking a rate review process of being able to look at, for example, what are those reimbursement rates that our providers are getting in the state of Rhode Island? How do they compare to our neighboring states, and what effect is that having on the workforce? And really, are they reflective of the value of the care that's being given? And so that was a huge step. The other thing that the General Assembly has done over the last couple of years is to look at those barriers to our workforce pipeline. And so to become a mental health professional, not only are there educational steps that a person has to complete, but then also there are steps that are guided by regulations that we set in this state around licensure. And one of the things, and I'll probably talk a little bit more about this later, but one of the things that I think is really missing in our system here in terms of mental health care access is flexibility. And one point of flexibility is thinking about the paths that somebody can go through to become a mental health care provider, to become qualified to be able to be a helpful person in a capacity in our community. And so there have also been some legislative steps to look at different pathways to licensure that allow, for example, for professionals to be able to be reimbursed by insurance companies at an earlier stage of their career, which then opens up opportunities for them to see more clients. And finally, we also, as a state, have adopted the 988 crisis hotline model, and that continues to be worked on to be funded and built out to not only be a crisis model, but also hopefully soon a mobile response model that will be available statewide for people in points of crisis. And so, all three of those things are pretty major steps ahead, I think.
I'm going to stick with you, Senator, because one of the things that I was kind of pulling my hair out as I was doing research for this conversation, talk to lots of people, and they all say, boy, we have to get, as Professor Rosenthal was saying, we have to get obviously more licensed clinicians, and particularly people of color, and
Yes.
people that look like the patients they're serving. And my area of somewhat expertise, if there is one in Rhode Island, tends to be around education. And this conversation is one that plays out in K through 12 every day, right? And it was playing out before COVID. It's much, much bigger topic right now. And so I started to ask people, like the last couple of days, so what's the barrier? What's the problem? Somebody said to me, there's a really tough testing lobby in our state and all around the country. Can you just talk a little bit about that? I mean, does that mean there's just real pressure from the licensure companies that sort of try to block making it easier to become a clinician?
Sure, yeah. So I think, as I was mentioning, in order to become a licensed mental health clinician, and I do also want to say, there are medical professionals, there are psychologists, I mean, there are kind of all different pathways, but when you think about the service delivery of mental health in Rhode Island, for the most part, you're talking about master's level clinicians who have completed a set of coursework that then qualifies them to sit for some type of exam, whether that's, through the social work board or whether that's through mental health counseling or through licensed marriage and family therapy. And yes, it is a standardized test. One of the pieces of legislation that I worked on last year actually had to do with waiving the testing requirement for the first level of licensure for social work students. And one of the things that I learned through that process of working on that bill is that while we do value and want and need clinicians who speak languages other than English, that test is actually not offered in any languages other than English. Neither is the exam for the licensed mental health counseling exam. And so if you have somebody who has, first of all, just to kind of fill in the gaps here, somebody who has completed a master's degree and as part of that master's degree has done hundreds or potentially even thousands at the point of taking the licensure exam, hours of direct service work under a qualified supervisor who has said this person has the skills that are needed to be able to provide mental health support. If they're not able to take this very technical multiple choice exam, very wordy multiple choice exam in their native language, that's going to be a huge barrier for them. And it's borne out by the statistics, is a huge barrier for them to be able to actually pass that licensure exam and practice in the community. And then, before that, you have the barriers of it is very expensive to go to college and then grad school. All of those hundreds to thousands of hours that I talked about of experience that you have to get to even graduate from your master's program are unpaid currently, which is another huge barrier for people who usually have to work and put themselves through grad school. So you can kind of see how those things stack up.
I mean, ballpark for you, a kid that's 18 years old today, about to go off to college, maybe just started their freshman year, all in, how much is the cost to get your master's and everything? What kind of price tag are we looking at?
Well, thanks to the efforts of the General Assembly.
Well done.
If you if you go through CCRI for the first 2 years, and then you go to Rhode Island College for the second 2 years, I mean, there's definitely a cost savings there for your bachelor's degree. It's in the tens of thousands of dollars at least, to be able to get, even if you were able to go through your bachelor's degree without cost, your master's degree will still cost at least in the tens of thousands of dollars, even with kind of the maximum amount of financially that you could get, or student loans, which presents its own issues when you then are entering a field that has such a low rate of pay.
Dr. Haywamudalige, another kind of common topic that has come up as people submitted questions, and I think we talked about this offline as well, is the role of primary care. And I'm hoping you could talk a little bit about how important it is to that having a primary care provider and then having sort of those referrals and things like that. Talk a little bit about how important it is for the role that primary care plays in mental health access.
Absolutely. So, just kind of piggybacking on the concept of destigmatizing mental health, I feel it starts with your primary care provider. You can have that initial conversation with them. And what we do at PCHC is we have touch points throughout the organization that have a behavioral touch. So in the moment, if a patient is in crisis in front of me, what I can do is I can grab a behavioral health advocate or someone who works in our organization in the integrated behavioral health department to meet that patient where they are in the moment. So that's sort of how we try to address it. It's very, very important that we allow for there to be easy pathways of referral, especially for those patients that, really have issues with escalation or they're really in crisis. Those patients need to have easy pathways for access, and so we feel that the integrated model really is that important. So having primary care and behavioral health available at the same place, at least for a patient, that becomes kind of like a one-stop shop. So if we can adopt that kind of model Rhode Island wide, I think we could reach more patients that way.
Can you just hold my hand and kind of take me down the path here of the average day at PC HC? What do you see, and how, is this an everyday occurrence that you're seeing somebody come in that's in like dire need of sort of mental health support?
I would say it's a range, right? We have patients that have mental health issues regarding how they're raising children or coping with new parenthood or potentially job stressors, work stressors, life stressors in general. So it could come up in anything. And we also find that chronic disease is a huge burden. That in itself can precipitate depression and anxiety and all sorts of issues on a spectrum of mental health. So it's important to have those services available at the primary care setting as well to make sure that those patients have that access to cope with the rest of the chronic conditions that may fall if that mental health is not taken care of.
Professor Rosenthal, your one area of expertise for you is among young people. And we all know what COVID kind of did to our young people, and we see it up and down, whether it's in school attendance and test scores. But just, I read survey after survey, some of the if you guys haven't checked out the survey works data that Rhode Island Department of Education conducts every year, and we're talking virtually every student in the state, and every parent actually, and every teacher as well. But you dig through that data, and it's not particularly presented well, so you really have to nerd out a little bit and go through it. But time and time again, there's just glaring red flags about about how vulnerable our young people are right now. Can you talk a little bit about the need to catch, I guess, young people kind of where they are, but also before something catastrophic happens?
Yeah, thank you so much. This is definitely what I spend most of my time on. So I would say we know that about 75% of mental illness onset is before the age of 20, right? About 50% is still in childhood. So by the time young people get to adulthood, right, that age of 18 to maybe 25, young adulthood, right now we're seeing prevalence of depression that's or basically the majority. We're seeing like 50% plus, which is unprecedented. And many of the factors have to do with what you mentioned. But I think what we need to do is rise to the occasion. I think we need to understand that this is unprecedented and we need to do something new and something different in response. And it's not as simple as crisis care. It's not as simple as workforce. It's trying to build communities that are supportive of young people and their growth and development as they are becoming adults, right? It is not just like places of higher education should not just be to educate students. It should help them to holistically develop in healthy ways because they live there oftentimes. That's where they go to the gym, where they eat their food. It's their whole lives. And I think there's still a workforce problem in terms of on college campuses, in terms of having enough, whether it be social workers, licensed mental health counselors, psychologists, but it's also how do we support the students who have very few resources, right? Are going through childhood, entering young adulthood, without the means, without the resources, are trying to go to school, work 1 or 2 jobs. I think what we need to do is look at the social determinants of health. We need to make sure that people make a living wage. We need to make sure that people have stable housing, have a consistent source of food, right? If basic needs aren't being met, which quite frankly are not a lot of the time, it makes sense that we're ending up with so many people who are depressed, right? Because then on top of all those basic needs, then there's the really hard parts of life, right? Like that COVID disrupted things, that maybe the long-term outlook for young adults is not as positive as it's been in the past. So I think we need to take a holistic view, and I do want to take this opportunity to just mention that telehealth is incredibly important for young adults. Young adults are the most positive about using telehealth. The majority are happy to use it. We know that it's most likely to reach the young adults who are the least likely to regularly access care. So people who are lower income, people of color, sexual and gender minorities. We need to expand access to telehealth for young people, whether it's on college campuses or not. And there's also got to be a legislative solution to that to make it easier, and make it easier for practitioners to do that, make it easier for patients to have access to that.
It kind of seems like we did a pretty good job with staring down a crisis to very quickly pivot to online learning, but also telehealth. But then it's almost slowed down to some degree. Senator, can you fix that problem?
So I will actually just give a shout out to Chairman Josh Miller, who is in the audience tonight, who did actually make telehealth permanent in Rhode Island state law in 2021. Right, do I have that right, 2021? So yes, please, round of applause. I think that the issue that still remains with access and that we're starting to chip away at is the idea of telehealth across state lines, for example. So being able to access care from a person who specializes in something, or to be able to keep up continuity of care when somebody moves away. And so there are still a lot of barriers, I think, to be overcome there. And I also am curious to see, as kind of our new cohorts of workforce come out into the field, what kinds of work they're doing as part of their coursework to prepare them for integrating telehealth into their practice model, if they so choose. Because as a clinician who did pivot to telehealth during COVID, and then now kind of does a little bit of a hybrid in my own practice, it is a different skill set. To be able to engage, especially with somebody who you've never met before in person, to be able to figure out kind of how to run a practice that way, and be able to do effective interventions that way. So I think that we need to both continue to work on the workforce development part of it and see what works, and also remove some of those regulation and legislative barriers to especially the interstate piece.
It dawns on me, and this could be for any or all three of you, has training caught up to the telehealth concept? So, are we doing a good enough job of training our, future doctors and clinicians in that world, or are we still, kind of stuck? I can speak for sort of the way journalism school tends to work, and we're still very much stuck in like a print newspaper time, when that's not really, despite what some of my bosses might think, feel. So can you talk about the training part of this, and how much we need to maybe have people coming out of school ready to do telehealth? It could be for any of this.
I'm looking at the professor.
Well, I don't have to practice, so it helps me that I don't need that training. I don't think there's been much change to the training. I think telehealth was very much like a crisis response. I mean, in the same way that as a professor, I had to all of a sudden teach online without in a crisis moment. I don't think it's been meaningfully integrated into the education and training from what I've seen. But I don't want to, I haven't seen everything.
I would agree, because even with doctors, we're finding that it's a very similar concept. They're sort of getting that exposure almost inadvertently. It's out of a need versus an intentional drive. So I would imagine it would be the same.
I mean, look, it makes sense if you spend 30 years doing something one way, you're going, and you're asked to change immediately. It's very difficult. Change is hard for everybody, and so it would make sense. But you would hope that our training programs were at least preparing the next phase of doctors and physicians. Doctor, I want to go back to you. Another kind of broad question, but a good one. What opportunities do you see to expand access to mental health care in Rhode Island?
Yeah, so I think, what I touched on previously in terms of that integrated care, I think that's a huge, huge way of doing it, is bringing our mental health providers to the primary care setting. What we find right now is, especially with our patients, there are so many barriers accessing care, period. Let alone in community mental health settings. And so sometimes the primary care office is the only place where they're seeing anybody for their health care. So, if we were able to, as a state, sort of move further and further toward that type of a model, I do think that would be a method to try to target patients to be able to get them what they need.
When we talk about access, not just for young people, I think for everybody, sometimes literally accessing a doctor or a clinician or anyone is a barrier, particularly outside of, I think, the urban corridor. I know there's been efforts to improve RIPTA service, things like that, but Professor, can you talk a little bit about the transportation challenges specifically that so many of our patients have?
Yeah, I mean, what we know is that transportation is a barrier, and that it might not be because someone doesn't have access to the bus, right? Or because someone doesn't have a vehicle, which often can be the issue. It might just be because someone has to, take a kid to school and then has the full workday, and they're not going to be able to go, at that same time to wherever they need to go. So not to say the same thing again, but I want to say that is one of the main benefits of telehealth, is that you don't have to have that transportation piece. But I do think that, like, our public libraries, for example, should have rooms with internet access to make telehealth available, so that we're not just making the assumption that, someone who maybe doesn't have transportation would just have the appropriate device and internet access. Like, I think we also need to embed access in other public spaces. But I also think there's more that we can do to invest in transportation services than we do now.
Senator, one of the issues that I know you have worked hard on, and I know the legislature is always kind of harping on, is Medicaid reimbursement rates and things like that. Can you give us the scope of kind of where things stand today? I know there's a very new report out, and there's some recommendations to change those reimbursement rates, but can you talk a little bit about the bigger picture for that, and then, realistically, what are we going to see in whether it's the next legislative session or in the next couple of years?
Sure. So there is a rate review study that's happening currently, again, to look at kind of the where things are in comparison to our neighbors, and also kind of where they need to be, with, I think, the intention of trying to have some sort of forward-thinking plan that isn't just, raise it by X% and then it's going to stagnate again, and then we're going to have this fight again in so many years. Speaking as somebody who has been in private practice for the last 12 years, and does all of her own billing and things like that, my reimbursement rates are within $1 or $2 across insurance companies from when it started, from when I started my practice 12 years ago. Whereas my rent has gone up, my own cost of living in every single way has gone up, my internet bill has gone up, all of those things. And so it becomes unsustainable when really that is your only source of revenue, is being able to bill for an hour of time that you're spending with a client, and then you need to cover all of your expenses for that. As a person in private practice who does all the administrative work herself, that is one picture. When we think about our larger community mental health agencies who have to fund much larger facilities, have to fund all of their support staff, with, again, just that reimbursement rate, and then a number of grants that they have to patch together and things like that, that's not a sustainable system. And so the intention is to try to match that to something that is actually sustainable, and reflects the value of the work that's being done. So I think the reimbursement rates are a huge piece of it. I think that beyond the actual number, though, there's also an element of flexibility. And, both of my fellow panelists here have referenced the idea of flexibility, both in terms of where people are accessing their care, going to places where people are, and being able to provide care there, transportation flexibility around looking at barriers, but I also think flexibility in terms of the actual service model. So we do tend to think about mental health access in terms of a point of crisis or a point of like maintenance, of like, once a week, 1 hour therapy, with a person in an office. And I think that the reality is, we know that there are so many more ways that we could be offering mental health support, and we need to match those up with a way for a service provider to then be reimbursed for that work, because there are so many things that a mental health support service provider does that aren't necessarily reimbursed, or it's very difficult to get reimbursed for. All the extra phone calls, the consultations, 10-minute check-in with mom about how did the school morning go, and let me offer some support before our next session. There are a lot of things that can be very, very effective that don't look like the traditional service delivery model, and we need to be able to match those up with ways for those service providers to then get reimbursed for their time for delivering services in that way or in that location.
You mentioned Senator Miller, who's in the room. I know Senator Miller well. I know you, obviously. You think a lot about this work. Can you give some context to how, I'm just going to ask, how seriously the General Assembly takes this issue?
I think very seriously. I have to say, I am one of 38 in my chamber. We have 75 in the House, and I will say I've never once had a conversation with any of my colleagues of any political affiliation where they're like, "Nah, mental health, like, who cares? That's overblown." I mean, that is something that really does seem to be a universally understood fact, is that there are people who are not able to access services in all of our communities. There are very real barriers to that, and we need to figure out what those barriers are. So I do think that it's an issue that's taken very seriously.
That's a relief to hear. This is a question for each of you. And I told you I was going to ask this the other day. I'm always, in these panels, sometimes we get really bogged down in how bad things are or how much of a challenge we have. And that's an important discussion to be had, as why many of the people in this room are here. But I'm also really interested in solutions, and I think the best way to find solutions is to look to places and people that are doing this well. And so any one of you can take this first, but I want you all to answer it. Is there, whether it's a state or a city across this country or a county government that's really doing innovative stuff that Rhode Island can borrow from and just flat out steal from to really improve access to mental health care?
I can go first. First, I want to say I'm really proud of the state of Rhode Island. I really am. We're in a really tough time. I'm very happy to be here instead of some other states that really haven't tried to meet the needs. So there's a lot that we can still do, for sure, but we are working on it. And I'm proud to be in a state that's doing that. That being said, there's some innovative work happening in Colorado that, is a little controversial, but I happen to think it's a good idea. They passed legislation that allowed licensed clinical psychologists to get a master's in psychopharmacology. And then after that master's, then they could prescribe medications. We do have a shortage of psychiatrists and folks who can be prescribing medications. And rather than just working on these pathways, right, which are from high school students to get them all the way through medical school and through their fellowship, which we need to do it, but that's a long time before we get the workforce that we need. Why doesn't Rhode Island take a look at something like that and come up with another way that maybe we can have some more folks a bit sooner? Mm-hmm.
So I will say I just had the opportunity in late August to go to a convening of legislators from the eastern region of the United States and Ontario. So we actually met in Toronto and had the opportunity to talk about early childhood education, mental health policy, and clean energy policy. So it was literally a conference tailored to my interests, which was wonderful. But I will say that Ontario actually has a really interesting interesting model. And we're not so far away from being able to implement it because it does integrate a continuum of care that includes everything from point of crisis to follow-up to maintenance. And there are mobile response teams that they have. And, I think part of their conversation that really struck me was their focus not on starting with a point of crisis and then kind of working to make sure that there was a follow-up continuum of care, but actually taking a proactive look at how do you find those points of intervention long before the crisis occurs and allow for the idea of creative deployment of services before that point of crisis. And so I think that it's kind of a combination both of, we're sort of on the right track here in Rhode Island, but I think that being able to flip how we're looking at that, and especially that piece about the continuum of care and making sure that there are handoff points to appropriate levels of intervention for a person who's experiencing something is really something to follow.
So we have Colorado, Canada. Doctor, tell me Connecticut's doing something.
Well, so I'm actually happy you mentioned Canada. That's my home and native land. Sorry, guys. So I'm from Vancouver originally, and I think they're getting a lot right in Vancouver. I mean, going back to when I was even in high school, we were doing safe injection sites in Vancouver, and we have very, very progressive policies out there too. So I just feel like we could take some lessons from the east and west coast of Canada. So.
And I do want to say about that because, the conversation came up, and I'm sure many of you kind of had that thought in your head of like, well, of course, Canada, the health insurance system is totally different there. Of course, they can do something like that. And again, that's where I go back to, there are still decision points, though, even under a single payer system of who are we reimbursing, how much are we reimbursing, what are we reimbursing for? There are still those decision points that need to be made to build a continuum of care that are still something that we can replicate here, even under a different system.
You're making almost perfect time as scheduled, and I do want to open this up to questions from the audience here. You guys many of you are experts in this subject matter, so raise your hands and we'll try to get as many. We've got about 15 minutes to go, so we'll start with Dr. Rodriguez there. And please, if you don't mind, tell us who you are and who you're with, if that's okay.
I'm with Ed Fitzpatrick here. My name is Pablo Rodriguez. I'm a gynecologist, retired, and I'm also a webmaster with my website Nuestra Salud, which is a website in Spanish, a health website in Spanish, the only one in Rhode Island. So, but the state of Tennessee just passed a law that removes the residency requirements for international medical graduates to practice in the state. So for those of you who don't know, you could have a cardiac surgeon from Mexico come in and move into the United States, and they have to go through an entire residency program in order to be able to practice. So Tennessee, having a real shortage of providers, decided that that this is a barrier, so they eliminated the residency requirement, and now these providers can, after passing a test and developing, and demonstrating competency, they can practice in the state on a temporary license. And I was wondering if that's something that could be considered in Rhode Island.
Put that question to the senator again.
Sure, yeah, I think that's really interesting, and I would definitely look into that. You're also reminding me of a legislator I spoke to from Maryland who is also investigating opportunities for residents who are unmatched. Or medical school graduates, I should say, who are unmatched, and the potential there for being able to use trained professionals, especially in potentially psychiatry or primary care or other needed professions, and so that's a really interesting thing to look into. So I will add that to the list. Thanks.
Other questions?
Hi, everyone. Great discussion. My name is Carlos. I'm the CEO of a mental health care navigation company. I'm back here.
Sorry, I lost you, Carlos.
In case you're wondering. I'm really curious about really focusing in on how do we prevent burnout for physicians. Oftentimes, access is touted as the number one goal, but on the receiving end, physicians are seeing more complex patients, being asked to do more. What are some of the tactical things that we can put in place to help ensure that productivity remains high, but burnout actually doesn't occur?
Wonderful question, the question we're constantly trying to answer. So, we try to listen to our providers and hear the different issues that they're facing and what the challenges are in meeting patient needs. And again, to tell the same message, flexibility in scheduling, telehealth, making sure that we're doing flexible work weeks, things like that. Those are all ways that we're trying to meet the needs of our providers so they're able to, it's a fine balance, maintaining access with a flexible work schedule. It's tough. But what we're also trying to do internally is make sure that we have things like peer support groups, or Ballant groups, places where providers are able to speak to each other about the challenges they're facing every day and be that support for each other as another mechanism to deal with burnout. We've had some partnerships with great organizations as well that do, resiliency courses and things like that. But we know that burnout is not just a resiliency problem. It's a real problem that's happening based on our workforce. So those are some of the things that we're trying to do to combat that problem.
Thank you. Neil Steinberg, I can tell you your mental health improves when you stop wearing suits, so I highly recommend it. Just a quick question, but it's a broad topic. I've been surprised not to hear any reference to substance abuse. And knowing that co-occurring disorders are rampant, mental health, substance abuse, knowing that there's millions of dollars that's come in courtesy of the bad drug companies for substance abuse. I don't want to open up the whole can of worms. What I'm really curious about is how well coordinated it is. So somebody walks in the door, somebody's referred, somebody goes, these are not silos. Generally mental health and substance abuse go hand in hand. How well coordinated is it, and is there hope that we can attack both of those paths?
So there's definitely lots of pathways that we can take to try to address those coexisting issues. Medication-assisted therapy, dropping for those of you that are not familiar, there was a waiver that physicians had to get in order to prescribe substance abuse treatment. And fortunately, the state of Rhode Island, we dropped that, and federally they dropped that, so that makes it a lot easier to access those services for our providers, so they're able to get that training, they're able to prescribe at the point of care. So that's a helpful method. Doesn't solve it, but that definitely addresses some of the barrier. Otherwise, they have to go through specialized programs and navigate other avenues, so that can be very, very challenging. Having, again, keep plugging integrated care, but having integrated medication-assisted therapy is a huge way that we can try to address it. And again, it's conversations, discussing these things, taking away the stigma of substance use, making sure that our patients are honest with us about what's really going on, and that only comes from continuing to build trust and having those resources available.
Hi, thanks for the great discussion. I'm Bob Chatham. I'm with the Slater Technology Fund. We're seed stage investors here investing in startups in Rhode Island. And we've talked a lot about the supply side problems, lack of providers. I'm curious if there are any demand side signals that you watch, kind of at a little bit more real time, like time to book an appointment or utilization of providers or those kinds of things that might be publicly available to help steer, where we can provide investment in technology, that might help speed up access or make care more available.
I love this question. You have money right there. Let's solve a problem.
So I will say, as somebody who lives in and represents the southern part of our state, one of the things that the advocacy organizations and the health equity zones in our area are really focused on are the fact that we are definitely underrepresented for providers geographically. So, to kind of answer your question, I think that there's it's a tough metric to try to figure out, because technically, could there be availability for a 13-year-old experiencing, symptoms of depression who lives in Westerly? Sure, if they can get to Woonsocket on a Thursday at 2 o'clock. So I think it's a very hard thing. We don't currently capture that, I guess, is the short answer to that question. We do capture things around like amount of time that somebody might wait for an inpatient psychiatric bed. That metric is definitely tracked. But some of those things currently, I think, are a little bit harder to get our arms wrapped around, because, again, there's kind of just that interaction between geography, need, good match, expertise in the specific area that person might need, and those things we don't currently, to my knowledge, I don't think that we're tracking right now.
Thank you very much. My name is Scott. Primarily, I'm a parent. I also am a mentor at Providence Public Schools. Started learning a lot more about adolescent mental health. So my question is kind of referencing a couple recent news articles, and love to get your guys' take. So I think it was yesterday, our governor and our education commissioner had an op-ed in Projo talking about a focus on investing in our kids. Also 3 weeks ago, the Washington Post had an article about we're 100,000 school counselors and social workers short of meeting the need. And so, Professor Rosenthal, we're talking a lot about workforce, but you talk a lot about, let's dream big. What are some different ways to tackle this problem? Curious what Providence Public Schools and school districts in Rhode Island should be thinking of to support student mental health.
Also, thank you for volunteering.
Yes.
Thank you for that.
Yeah, thanks for the question. I think in Rhode Island, we're something like one school mental health counselor per 380 some students. And they say the benchmark is 1 for 250. That's the ideal, which sounds frightening that it's 1 for 250, especially in the current state. So you're right. We're not in good shape. A lot of it's a workforce issue. What I will say is that Rhode Island has something really great that not every state has, which is Rhode Island Student Assistance Services. If you're not familiar, it's an incredible organization where counselors are embedded in the schools. It's not every school in the state, but we're getting much closer to every school in the state. And those counselors implement different programs, evidence-based programs that have been shown to at the population level, reduce depressive symptoms, even reduce substance use outcomes. They're more in the middle and high schools, but I think there are some in the elementary schools. And I believe they're getting funding from kind of like external funding, but I want to say even from different organizations within the state to continue to expand. And I think what's really unique about it is that they're not employed by the public education system, right? Like they're not employed by Rhode Island Department of Education. They're a separate entity, and yet they're embedded in the schools, and they can build relationships with students and support them and be safe spaces. And that's something that I can't even fathom how that started and how that made it through to begin with, but it's been many, many years now. But I think continuing to expand that organization, and they get a lot of social workers just out of training, so young people that connect with kids, and we know it's effective. So I think we invest as much as we can in expanding that program at the elementary school level as well, and getting as many counselors in there as we can, because we know it works.
You know, something that comes to mind, I'll let you go, Senator, to that, as you were asking that question, as you were talking, in a previous life, I was a City Year AmeriCorps member here in Providence, and had a great experience making, I think, like $7,500 for the year, and living very, very much on lots of subsidy and 7 roommates. And I'm just a huge advocate and big supporter of the AmeriCorps program in general. And one of the things I was thinking is I remember this was years ago, but going to college campuses and talking to students about potentially taking a gap year and getting into our schools and thinking, not that you're going to come out of college or quite frankly, City Year accepts high school students, high school graduates too, but they're not ready necessarily to go on to grad school, or maybe they don't even want to get into this work. I wanted to be a journalist, but I wanted to do a year of service. And there are so many people that go through that program and their lives, are completely changed, and then they do go into that work, and they can, they are the workforce of the future. I wish AmeriCorps would do a better job of broadly, this is a national challenge, of really promoting that work, and also pay more, because that would be really helpful.
Yeah.
Senator, go ahead.
Yeah, so I just wanted to piggyback on the statistic that you gave. So if you think about that idea that currently we're at 1 to 350 in terms of ratio, that's not like in every school system. So actually Providence is one of the school systems where they actually meet the recommended ratio of 1 to 250, but there are other cities and towns that are, it's up to like 1 in 800, I think, is one of the worst ones. And so, one of the things that we have investigated, and I'll be picking this back up again this year, is looking at developing a student loan forgiveness program for social workers who choose to work in schools, specifically underserved schools, so the ones that are not currently meeting that ratio, and trying a pilot to see if that helps. I'm very interested in your idea, though, about expanding the other program where counselors are embedded in schools, because one of the biggest challenges in keeping and retaining school social workers is that they are only 9-month employees. And so a lot of times what happens is it's not a very attractive work opportunity for somebody who is not going to be able to pay their bills on the salary they make over 9 months, and there's not much that a social worker can do for just 3 months in their field over the summer. You can't really build a practice and run it for just 3 months of the year, and there's no guarantee you're going to get hired back the following year. So there's some structural challenges, I think, to the way that we do that, but I think that's a really interesting thing to pursue. So let's talk more.
Yeah, let's do it.
Hi, my name is Juniper. I work for River's Edge Arts. We're a 501c3 after-school program focusing on workforce development as well as out-of-school time learning. We're based in Woonsocket, so I appreciate the shout out to our city, and in general, a fabulous conversation thus far. We work with an incredibly high-need population in a lot of ways, and access to care is obviously an incredible challenge for a lot of the reasons that we've discussed, geography among them. And telehealth is, of course, a really important piece to that puzzle, but I really appreciate Professor Rosenthal discussing alternatives, including, to paraphrase you, embedding access into public spaces. That's something that we've tried to do, but experienced a real challenge. Being able to have providers in our site is incredibly difficult, or to create space for youth to be able to use our site in that way. So I'm really curious as to, one, political will for investing in those kinds of solutions, and what other kinds of strategies we might be thinking about in addition to things like telehealth for bridging those transportation barriers. Just to add one more thought to that already long question, thank you, is frankly, we have youth who don't have space at home, in addition to things like devices and access to be able to use that service. So anything in that realm would be immensely helpful.
Yeah, I mean, I would just say, I think like public library is what I've thought about, but I think depending on what city or town that you're in, what the most appropriate public space is, but there could be devices that are publicly available and quiet spaces that are publicly available, as well as reliable Wi-Fi. But the political will is something I can't speak to.
Yeah. So I think, there is a program currently in Narragansett High School. They have a partnership with Thundermist, and they provide space and connections to therapists in the school. And, so I'm wondering about, the opportunity for partnership with organizations. I know there's a Thundermist, in Woonsocket as well. I don't know if this is a pilot that they're doing with the hope hope of maybe expanding that to other locations. And, I would want to learn a little bit more about the challenges, space-wise and things like that. But I think, one of the best things that we can do is also try to come up with solutions that are not necessarily one size fits all, because what works in one community is not going to work in another. And, again, you have to have the providers to be able to want to engage in that model. But I think that there definitely is that will to be able to provide, to remove barriers to access, and also something that, ultimately, and this didn't come up a whole lot, but the other thing is that when you're talking about increasing access to mental health care, it also is a huge cost savings in the long run. There are tons of different metrics that you can look at for that, but when you're trying to make the economic argument about investing in setting up access points, I do think that that's an important part of that conversation too. But I'd be happy to speak further about, kind of what those specific challenges are.
The good news is we still have time to have drinks and network here. I think we have to wrap up. I'm so sorry. Corey's going to come up, but can I give one last time? Can we just give a big round of applause for this wonderful panel? Thank you. Thank you both. Thank you all so much. I want to give a couple of quick shout outs before we turn it over to Corey. Once again, to the sponsors of this event, CCA Health Rhode Island, Johnson & Wales, the Rhode Island Foundation. Thank you for making this conversation possible. We're going to continue to have these conversations. We want to continue to have these conversations. I want to thank all my colleagues at Globe Rhode Island who are scattered throughout the audience and who are desperate for you guys to pitch them stories here, there, in the back, they're everywhere. If you don't already subscribe to Roadmap, my daily morning newsletter, please do so. There's lots of fun stuff. We dive into important topics, but also, we promote events like this one, and we're going to, like I said, continue to have these kind of things. So thank you all so much for being here. Please stick around, have drinks, enjoy this beautiful, beautiful space, and let's turn it over to Corey.
Wow, you took a couple of pieces that I was going to do, so thank you. Shut it down. So I do want to thank you, Dan, for moderating this conversation. It's such an important conversation for us to be having. I want to thank you, Professor Rosenthal, Senator DeMario, and Dr. Hiwamuta Lige. I think I got it right. So just to wrap up a couple of things, one stat that stuck with me from Professor Rosenthal, more than 75% of mental health onset is before the age of 20, right? So just thinking about that and keeping that in perspective as we think about how we try to design our healthcare system to support this. And a couple of key takeaways that I have. One, we need to find a way to get sustainable rates, ensuring that providers are reimbursed appropriately and adequately for the critical care that they deliver. In this space, it's critically important for us to start thinking differently, to start thinking more innovative about how we make sure we're reimbursing appropriately for the care. We need to look at integrated care and be more intentional about looking at patients' entire health needs. And I actually heard it, social determinants of health. So it's medical, behavioral health, and social factors. We have to put those all together and start thinking about it that way. We need to create more flexible pathways to allow people to become a mental health worker. Community-specific and community-led anti-stigma campaigns, really important for us to focus on. And the last one I heard as I was going through, which is really just meet people where they are. We're talking about trying to engage people in a conversation and care that carries a stigma and is sometimes hard to find these individuals. We have to meet them where they are, whatever that means. That could be at a Dunkin' Donuts, that could be at a McDonald's, it could be on the street. Right, we've got to find them to be able to have that conversation where they are, not expect that they're going to find us as part of the delivery system. So thank you all for coming. This is an impressive turnout. This is only the start of the conversation. I want everybody to continue to have this conversation. At CCA Health Rhode Island, we want to be part of this conversation. We want to help provide solutions, and we want to be part of the solution for Rhode Island. So please, I'll be around throughout the rest of the next half hour or so. But I am also available if you ever want to send me an email, reach out to me. I want to have the conversation. I want to help be part of the solution in Rhode Island. So thank you all.